If you're a runner who's injured their knee and you want to get back to running in the fastest time possible, I'm going to go through my 5-step plan how I get people back to running after a knee injury. Now, this is going to be particularly aimed at people aged 50 plus. My name is Ed. I run a physio practice in Southwest London, and we specialize in treating running injuries. So let's get started. Step 1, before we start any treatment, we need to get a diagnosis. Different injuries behave differently, recover at different speeds, require different treatments. For example, a tendon, we might need to load it differently to, say, meniscus tear, and we might need to treat it differently to something like osteoarthritis. We also need to rule out the possibility that the knee pain may be coming from somewhere else, for example, the back. Now, sciatica is more common in people aged 40 plus. Sometimes we can get pain that refers into around the knee. So we need to make sure that what we're dealing with is definitely a knee problem and not anything else. So that's the first thing we need to do. Second thing that's really, really important is start to understand why the injury happens. Now, for runners, often it's going to be because they've run more than their body can tolerate, what we call a training error. And this is where someone effectively goes beyond what their knee can tolerate in terms of how much they run, and that causes the knee to get irritated, angry, sometimes injured, and sometimes causes things like tissue damage, swelling, and things like that. But there may be other causes as well. For example, someone I treated recently came in after spraining their ankle last year. They got back to running and were able to go back to their normal kind of running routine. But as soon as they started to increase their mileage beyond what they normally would do, their knee started to hurt. And what it presented like when we assessed that person was that the calf and the ankle were doing a lot less, which was making the knee do more. So because that ankle sprain wasn't properly treated, what it meant was all the muscles around that area weren't doing their job very well, which was meaning the knee was taking a lot more stress. Along with treating the knee, strengthening the knee, doing work to get it happier and healthier, we actually spent a lot of time on the ankle rehabilitating that old injury, basically. There's lots of different reasons why knee pain can come on as a runner. Obviously, there is sometimes can have a traumatic injury, and the root cause is obviously quite obvious there. For example, a fall. Now, step 3 is where we begin to put together what we call a rehabilitation program. Let me explain. What we need the knee to do is increase how much it can tolerate. How much the knee can tolerate is here. Running 3 times a week is here. We need to bridge that gap, basically. The way we do that is through rehabilitation. So things like strengthening, balance work, control work, coordination work, plyometric training, and lots of other methods that we use to try and get the knee back to a level where it can tolerate running. Sometimes we can use running as rehab as well. So if it's not quite ready for the knee to go back to running, 5K around the common, we might just get that patient to run on the spot. And even a step before that might be marching on the spot. We don't always have to use exercises in our rehabilitation. We can just use running as well. Common examples of how we might rehabilitate a knee injury, what kind of treatments we might use, would be using quadricep strengthening, hamstring strengthening, calf strengthening, glute strengthening. That's because they're all the key muscles that help your knee function when you run. We may be doing some knee extensions. We may be doing some prone hamstring curls, some bridges, some calf raises. Now, if someone is in a lot of pain, we're not kind of ready to start doing that kind of exercise. We may use hands-on treatment, some taping, or other methods to try and get on top of the pain. Just doing a quadriceps massage is sometimes what we use to just try and desensitize the area, because if we're trying to get someone to do loads of exercises whilst they're in lots of pain, it's very, very difficult. We need to take care of that first. So that's something that we use sometimes. People often ask about knee braces. There are no issues with people wearing and using knee braces, particularly whilst the pain is still there. Using them even after the injury's got better isn't a huge concern, but I would also want to get our patients back to a level where they didn't need the brace at all. Now, step 4 is the most important bit, which is the return to running. So the decision to return to running is really, really important here, because if you've had time out of running and you're age 50 plus, sometimes that means that although there's a normal amount of atrophy, so the muscles that live in your leg that would normally be getting strengthened from running start to decondition a little bit. That can sometimes just happen more when you're age 50 plus, maybe just harder to build back up. The return to running that we may do with someone who's age 50 plus may be a little bit slower, a bit more conservative. It doesn't mean that we're just going to delay them getting back to running. What we're going to do is use smaller doses of running initially to get their knee tolerating running again. So let me explain. We may do minute on, minute off, run, walk, run, walk. We may just start with just 3 or 4 repetitions of that, and then incrementally every day just add on an extra minute, and that would be how slow we might start. So we might do that 3 times a week, give it a 48-hour gap in between, just to be really conservative. Obviously, there are people who we accelerate through that a lot faster, and that's an example if we want us to be a bit more cautious. What we definitely don't want to do as well is when we're doing this return to running is cause any other injuries. Sometimes people can have time out of running, and their calf muscles start to weaken, and then as soon as they go back to running, their knee feels fine, and then they kind of pull a calf. So the benefit of a really slow, gradual return return to running program is avoiding causing other injuries like one I mentioned. So obviously as physios, we're going to be doing and taking steps to try and prevent that as well. So all of our patients will always give calf raises too who are having time out of running to try and prevent that. But if someone accelerates too fast through their return to running program, then there is always that chance that may happen. Yeah, calf strain is more common in people age 50 plus because elasticity isn't as good. So it's something to bear in mind along with tendon injuries as well. That's something to think about. And then step 5, we're back to running, the knees feeling strong, the knees happy with running. Really, it's about prevention. So we're looking at a continued preventative rehabilitation program that we may be getting our patients to do 1 to 2 times per week. This is going to be to help strengthen the quadriceps, the hamstrings, the calf muscles, the hamstrings, and also try and improve their running form and things like that as well. So that will be something that hopefully stop an injury like this coming back. It's also going to improve their performance as well. So there's lots of benefits to just continued strength and conditioning, particularly in people age 50 plus. So if you have any questions about anything I've gone through today, please let me know. Ask a question in the comments box. If not, then I'll see you on the next video.